Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. Welcome to episode 337 of the podcast. It's March 20th, 2019. I want to first make a quick announcement. My most recent book, titled Measures of Success, React Less, Lead Better, Improve More, is now available as a paperback book. You can buy it through Amazon. You can also buy it a couple different ways through the book's website, which is www.measuresofsuccessbook.com. You can buy a signed copy from me. You can do a bulk order. It's a 260-page full color book. So the printing cost leads to a retail price of $34.95, but Amazon, at least as I'm recording this, has been discounting the book to under $17 if you go to Amazon.com. Amazon in Canada has also had, I think, a little bit of a discount. But you can learn more about the book and all of those different ways to buy it, including the ebooks. Again, go to www.measuresofsuccessbook.com. Well, today with the podcast, it's my second straight episode with a healthcare CEO. Joining me today is Vance Jackson. He is the president and CEO of Davis Health System, which is based in Elkins, West Virginia. So today we talk about how he was admittedly skeptical about lean at a previous healthcare organization. But over time, or maybe it didn't really take that long, eventually he realized the importance of lean and the need for him to lead differently, working to get input from everybody instead of falling into the old autocratic way that we see, unfortunately, in so many healthcare organizations. So how does Vance lead by example as a CEO? Why is it so important for him to go out to the gemba, or the actual workplace, to observe the actual work being done in the workplace environment? I think that's a really interesting thing that Vance does, and I'm glad he has a lot to share with us here today. So if you want to find links to the show notes and other information, you can go to leanblog.org/337. I also want to thank the firm Value Capture for suggesting and arranging the interview with Vance. Davis Health System is a client of Value Capture. In terms of disclosures, I sometimes work as a subcontractor to Value Capture, and I just want to make sure that I've already disclosed it. So I'm rambling into the end of the introduction, but here is our guest, Vance Jackson. Vance, hi. Thank you so much for taking time to join us on the podcast. How are you?
Very good. It's a pleasure to be here.
So I was wondering, I always like to let guests introduce themselves. If you could tell the audience a little bit about yourself and your career and how it was that you I guess, end of the story, became president and CEO of the health system.
Yeah, I'm currently the president and CEO of Davis Health System in Elkins, West Virginia. But my career, I'm about 33 years into a healthcare career that went into after I exited the United States Air Force in 1985, and never really anticipated going into healthcare, but you just never know. And I started out in public health, and found my way into hospitals and health systems, and it's been a great experience. And I enjoy it tremendously. I moved from public health to medical group management and then into hospital administration once health systems started buying up medical groups. I thought, well, they seem to have all the money and buying all the medical groups. So I'll switch over to the hospital side and managed medical practices on the hospital side, and then moved more into the overall administration. Before here, I was with Mercy Health System of Iowa. Was there for 10 years, and got here a little over 3 years ago, and it was an opportunity. There's so much consolidation occurring in healthcare today, especially in health systems, that there's in Mercy Health System was a statewide system, but it was actually owned jointly between Catholic Health Initiatives and Trinity Health, two bigger Catholic systems. So a lot of transition towards systems, and this was a kind of an independent, small rural system that was still, like I say, independent. So I thought, well, there's an opportunity to not just be a CEO, but be the CEO that gets the final say in decisions. And I thought wanted to try that at least once in my career. So here I am, and it's been a very good experience. And I think now is the right time to be in this role because there's so much you learn moving through different types of organizations and different settings. And I think I'm here at the right time in my career.
Mm-hmm. And we'll come back and talk about your leadership as CEO, the role you play in encouraging and supporting lean in the organization. But first, I'm curious, and this goes back earlier before your time at Davis. But other question I always like to ask people is, how and when did you first get introduced to lean?
Yeah, so the first formal introduction was with the Mercy Health System of Iowa. I managed a network hospital. It was not owned, but it was contract managed. So I was CEO of a county hospital. We were connected to Mercy of North Iowa, and the CEO at that hospital. I don't know where he got it from, but he decided lean principles and the lean approach to process improvement was where they needed to go. And so he introduced it to, once they brought it into Mercy North Iowa, they began to introduce it to the network affiliated hospitals. And Michael Johnston, who was with Mercy, then went to Carolina's Health.
Yeah, I know Michael. Yeah.
Yeah, he introduced it to me, and I when I was in Danville, Virginia, I had done a lot of training around the Duran method, but I think that was more of the Six Sigma and statistical process control, very mathematical. The one how Michael introduced it was more of engaging frontline employees. He himself had come out of the Toyota system, and at first I was resistant to it because I'm like everybody else. Here's another system they're trying to ingrain in us, but it for the first time I really I felt like I embraced something that made sense to me.
And so how did you come? I mean, did it take very long before, like you said, it made sense and you decide, then maybe this is different than all the other programs that have been thrown at us before, or did it take some time?
I think it took time. Michael came in, and he himself was in the process of earning a doctorate in management and leadership, and he was using lean as kind of his curriculum to get to that end point. And he presented it from a very academic perspective. We did a lot of classroom work that he led other CEOs. It was a group of CEOs that he led through that process. And I'll say when we got to the point where and he really introduced the A3 practical problem solving as kind of the first tool. And that's where I really started getting hooked, because when you start actually doing it, you start seeing the impact that it has on the people who do the work, and you start seeing affect how people perceive their own job and their responsibility, whatever that is, in solving problems or improving the work they do. And to me, it was those moments. And Michael was really good about celebrating those moments when people would say, "This is it. This is what I've been looking for." And you see people change how they look at their job almost the moment they kind of get it. And I don't know what that get it really means, even after doing it for this many years. That get it moment is still excites me every time I see somebody experience that.
Yeah, I mean, I think it's a little bit different for each person. I think change, acceptance of new ideas is a process. It's funny, you're the second guest recently on on the podcast back in episode 334, I talked to a guy, Barry McCarthy from Australia, and he worked for Toyota there for a long time. But in the conversation, he said before joining Toyota, he was in more of a food production industry, and he used the word resisting. He said, "Oh, when I first learned about this Toyota stuff, I was kind of resistant to it as well." But he came along, and I think you said it really well. Like, I cringe when I hear sometimes people talk about, oh, well, this lean theory. I'm like, well, yeah, there's theory, but it's practice, right? It should be something that we can quickly demonstrate to people and let them demonstrate that, yeah, there's benefits here, right?
Absolutely. Yeah, and Michael was very academic, but he had an associate that he brought with him, Bob Mussman, and Bob had been in the Toyota system, and they worked well together, but they approached it a little bit differently, I think, but partly due to the roles they had. But Bob was like, A3s, you just do it and do it and do it, and you don't have to do it perfect. Just, he used to say, don't let excellent get in the way of good. Mm-hmm. And he was very much about, okay, if you don't get it right, just tear it up and start over. There was
There's too much to erase. Yeah.
yeah. And so he really was just figure it out as you go along and let it develop.
Mm-hmm. So, thinking back to, we talked in our prep call, you talked about some of your experiences there at Mercy. And I'm curious if you can talk about, what did you learn about going and doing workplace observation?
Yeah, that is tough. And even to this day, as many of them as I've done, and for different reasons or different purposes, it's still, that you still get that moment of uncomfortableness when you walk in and everybody's kind of looking at you, but it never fails that I learn something every time I do it. And I learn something about myself, and I learn something about the work that I'm observing, and the different reasons you're doing it. Just observe without asking questions, or observing to learn more, and you ask probing questions, or using the Socratic method to try to better understand. And it, even though, like I say, I guess it's like people who like acting and being on stage, there's always that stage fright, but doing observations, that if you can just, and that's what I tell people, if you can just get past that initial moment of uncertainty as you walk into that setting, you learn so much, and like I say, it just, every time I do it, I learn something different about what I'm observing and who I'm observing, and it really is. You understand things that you never really captured before. Mm-hmm.
So it sounds like that's something that you continue doing even now at Davis Health System.
Yeah. As part of our Davis Way training, and Davis Way is what we call our process excellence model of learning, and we just try to personalize it, so we call it Davis Way. Quarterly, all leaders come together, and we start the half day activity doing an observation, and our process excellence leader, Elizabeth, she will tell us and give us the sheets and the instructions on what we're observing and why, what methodology we're observing, whether it's just to observe work being performed, or to observe and ask questions and get a better understanding. So we start every quarter when we do that event, we started with some type of observation, just to get leaders comfortable with doing it. And it's funny, the departments that are observed, and because we do it in small groups, and so we hit multiple departments, our departments are starting to get really comfortable with leaders walking in and just standing there observing them.
Well, that's a good thing. And sometimes that comfort, it takes a little time to build. I've seen in different settings. At first, people kind of tense up, or they think maybe instinctively, oh, what's wrong? And then they learn that this is actually becomes normalized, and it's something that's helpful, because I assume that observation, people learn that leaders aren't there to find fault, or it's not an audit. You emphasize learning and understanding.
Yeah, and Elizabeth's great about making sure that we do a couple of things. She informs the department leader, this is what we're coming, make sure your people understand. They are not in any way evaluating, judging. They are learning to better understand. and we even wear on our badges, we even wear little additional tags that said observing to better understand.
Oh.
And then after we leave, when we're doing the more academic part of the training, everybody writes a thank you note to the person or persons that they directly observed.
That seems like a really important part of the equation there. And I was wondering, I think that this is something I'm really happy to hear that you do this, because I've always tried to encourage leaders, and I've seen how powerful it can be to go and observe the work for a period of time and to start to see the real reality. I think there's a risk sometimes when I see organizations now talking about, we go to the gemba, and a lot of times that means we stand in front of a bulletin board and hear reports of what's happening, which is a different reflection of reality than actually observing the work, right?
Yes. Yeah, and that's just part of what we, going to gemba is not one thing. It is different types of things. And leadership has to be deliberate about what type of gemba are you trying to accomplish, because you're supposed to learn from that. So don't walking around. I came up through graduate school when the phrase "management by walking around" was the hot term, and gemba is more than just management by walking around. Right.
Yeah. Tom Peters, I love Tom Peters, and he, I think, was the one who really popularized that phrase. But there are more effective things that leaders can do in walking around. I've been, before I got into healthcare, there was an organization where management by walking around meant, going and slapping people on the back and shaking hands. That's fine, but that doesn't really improve anything, I don't think.
Yeah, I still have an old VHS tape of Tom Peters' presentation and in search of excellence.
Mm-hmm. Yeah. So do you mind, can you share, is there a recent example that comes to mind of an observation that you did, as much detail as you would feel comfortable sharing?
Yeah, I would.
What you were observing and what you learned from that?
Yeah, we the last training we did, we broke out into teams, and the observation that we did was observing for safety. We were looking for when you just stand and look, is the environment safe? Is the physical layout safe, or is the interactions, are they between staff safe? And so you're really, Elizabeth had us focus on safety. So we went to a nursing unit, and we kind of broke off, and it was a busy day, so we kind of broke off in ones and twos. My team, other teams went different areas, but my team of about 8 people broke off into ones and twos, so you didn't have 6 people standing around one nurse. So, and then we just observed either nurses or nursing assistants, and you're paying attention to a specific aspect of work, and it's really about, does this employee, have we created for this employee a safe environment, professionally, physically, and emotionally, and that really, it makes your mind run while you're trying to watch it and think, okay, this is something you realize I've never really paid attention to that kind of thing before in a focused manner, and so it was very enlightening, and you see things, and that that's one of the things I'm much more, and not just because of that, but because I've been trying to practice lean for a while. Safety is something that I'm much more focused on when I just walk around and observe than I used to be. Is that safe, and could it be safer? And that was really, and I think even the people who didn't have very much experience in it, it was very eye-opening about just how to observe a worker and the environment that they work in.
Yeah. It's really powerful for leaders at all levels. I'm sure you're setting an example as CEO. There's an expectation that leaders working under you in the organization are doing the same thing. Is that a fair assumption?
Yeah, and that was very deliberate. When we developed the Davis Way, we used a company called Value Capture out of Pittsburgh, and they were very adamant that when I was first meeting with them, that from their perspective, that the CEO has to be directly engaged in this and has to be setting the example and those types of things. And I must say, for me, it wasn't that hard, because I observed that at Mercy. Jim Fitzpatrick, who was the CEO there, he was there with us the whole time we were learning.
Mm-hmm.
So that was kind of the example that was set for me. So for me, that was like, okay, that's what a CEO does when they're trying to say to an organization, we need to learn the principles and the culture of lean if we're going to be a performance improving organization.
Yeah, and James Fitzpatrick, or Fitz, he's somebody I've been trying to get on the podcast for a long time. I've crossed paths with him in Iowa, and I think through an event called the Lean Healthcare Transformation Summit that he's participated in. And it's just, by the way, it's just a quick detour. You mentioned having been in Iowa, you're in West Virginia now. Iowa, compared to other states, really has seemed like a hotbed of lean healthcare, and I think a lot of it is the manufacturing companies in the state. Pella is one that comes to mind, where I know people have left Pella and gone into health systems. I'm sure I'm just blanking on other companies, but it seems like it's no accident that around the country, where you have a good base of lean manufacturing, that spreads through the community in different ways, either through people changing jobs or the manufacturers realizing, hey, we can help the hospitals improve quality and reduce cost on the healthcare that we're paying for our employees, right?
Exactly. And I don't know. There is a lot of manufacturing, especially on the eastern side of the state, and Caterpillar has a there's a I can't remember the name of it right now. There's a car manufacturer in near there. So yeah, I think there is a lot of that cross fertilization, and you see that in the county where we worked, there was a company that made utility trucks for mining industries. And they do lean, and it was interesting. We were there just for a tour because they were in our service area, and we provided a lot of workers' comp care to their employees, and we were looking to work together on some other things, and walking through the plant, and all of a sudden there's these huddle boards up there. Now, they were different from ours, but it didn't take you long to kind of figure out what the flow of their huddle board was. And so, you even, in talking with them, you even learn things that they're doing. You're thinking, wow, I could probably use that in healthcare as well. That's a pretty good concept or utilization of a tool.
One other thing I want to kind of come back and follow up on, so is the power of leaders doing observation. And then you mentioned among the dimensions of safety, professional safety, I think, creates, it's a lean environment, going back to Toyota and other examples, creates an environment, leaders create an environment where it's safe for people to speak up and either report a concern or a risk or a mistake. So I'm curious, from your leadership role as a CEO, what types of things do you do to help create that environment where it is safe for people to point out safety problems that you can't see as an observer?
Yeah, I think healthcare is safety, and until I got into lean, you just kind of accept, safety is, that's healthcare. Of course we're safe, but that Institute of Medicine report that came out several years ago that talked about the number of bad outcomes that occur in hospitals every year because they're avoidable. I think it was 119,000 deaths per year that were avoidable in a hospital. And so there was this awareness of it, but when you start thinking about, what really is safety, and you talked about, physical, professional, and emotional, and you really begin to focus on it, you begin to understand that safety is multifaceted, and you have to really pay attention to it. And so, we try to, when we say Davis Way, it's more than just lean tools. It's a frame of mind, and it's a principle that you follow. And one of them is one of the mantras that we try to, and we use visual management, and we try to really ingrain in our leaders to practice, is it's process, it's not people. It's about the process, and every new employee orientation. We do new employee orientation every other Monday, and I get an hour to do my part as the CEO. And that's something I say to people. I've been in healthcare for over 30 years. I've been in that environment where I've been responsible for an organization's quality management efforts. And when bad things happen, you're trying to pick it apart and dissect what happened and how it happened. And the history, I tell them, of healthcare, unfortunately, many times is when bad things happen, people point fingers and say, "What did you do?" And I said, "What do you think happens when you do that to people?" They avoid acknowledging unsafe situations because they don't want somebody pointing a finger at them. And I said, the two things you have to keep in mind: it's process, it's process, not people. And unsafe situations, are call for people speaking up and saying, we have to stop what we're doing and make sure this unsafe situation doesn't impact us or our patients. And so, it's one of those things where I hope that's a message I think we have to repeat constantly. Every orientation class, every time we're training under Davis Way, we have to kind of reiterate, because it's so easy just to have a problem and say, okay, whose fault is that? Who did that? What happened? And do that finger pointing, and you've got to stay away from that.
I mean, I think, there's a lot of human nature that we're battling there. So I appreciate what you're saying. It takes constant reinforcement. And, I would propose fighting this blame instinct requires practice and vigilance. I mean, as much as I have intellectually processed the idea we shouldn't blame people for systemic problems, there are still times in my life where I find myself thinking of like, oh, this waiter is terrible. I'm like, well, no, wait a minute. That's probably not actually the case, that there are systemic problems here. And I've gotten better at sort of stopping the thought before it comes out of my mouth. But there is really, I think, a lot of evolutionary human nature that we're fighting here. It's easy, it's tempting, it feels good to blame.
Oh, absolutely. Yeah, I agree. And first thing I do is try to look inwardly before I look outwardly, so that I make sure I'm not coming across as something of a hypocrite myself.
Yeah. That's I think a great leadership behavior and trait to demonstrate. So I was wondering if we could go back a little bit. I'm curious if you can talk about when you first became CEO at Davis. You had this prior exposure to lean. Was lean? Were you introducing lean, or was there something that you were helping build upon or trying to help shape from your perspective as the new CEO?
Yeah, I think when you're the new CEO, you kind of have this thing. I want to show them how smart I am. That you want to come in and say, they hired me, and they hired me for a reason, and we're going to be a great organization, and you're looking for ways to say this is the value I bring to this organization, my ability to bring new thoughts, new ideas, and say, this is where we can go. And healthcare, when I got here, was at a it was at that point in Iowa. I think we were seeing the competitive nature of healthcare really start to impact utilization and reimbursement and those things. West Virginia, being a very rural state, had been a little bit isolated, so there was not this awareness of the pressures that were occurring outside of this region. But I could see that these things were starting to come into play. So when I got here, there was still a lot of operational practices that were in part of healthcare, and I had seen them used and practiced for many years. And you knew that you kind of know in your gut those are somewhat inefficient practices. One of the first projects we did was create a call center here, because this was, for a rural community, this is a large organization, and there were a lot of access points into the system, either outpatient services, inpatient clinical practices, those things, and each one of them stood independently. And this organization received 10,000 calls per month. And as you learn, one of the problems that I was first presented with was that they were dropping over 2,000 of those calls each month. So you get 10,000 phone calls of people trying to access healthcare. 2,000 of those, they don't even pick up the phone. And you're thinking, that nobody seemed bothered by that. That's just the way it was. And so you really see an opportunity to say, this is a significant process issue. What we really need to do here is help people understand that the importance of the customer accessing your organization, your capability, and then how they work their way through the organization so that you get them what they need, and serving the customer. So it really, that was one of the very early things I picked up on. Was it wasn't that everybody was trying hard, everybody was working hard, everybody was doing what they thought needed to be done to serve the customer, the patient, and they just didn't have a perspective outside of the way they'd done it for so many years. And so I said, I think, guys, we could benefit from talking about lean process improvement activities. So I began to introduce it, and that's when I reached out to. I had known a gentleman in Iowa who had formerly been with Value Capture in Pittsburgh, and I reached out to him, and he connected me with them, and we began to talk about how could we introduce this and educate this organization about lean.
Yeah. Yeah. Oh, and I wanted to mention earlier, since you mentioned Value Capture again, their founder and chairman, Paul O'Neill, is, I think, legendary in manufacturing and safety circles, leadership circles. He's done a lot in healthcare to promote, among a number of things, the idea that leaders, executives, CEOs really have to lead lean. They can't just sponsor it or support it. That safety is a really motivating driver for organizational habitual excellence. And I did have a chance, I'll point listeners back to episode 124. I had a chance to talk with Mr. O'Neill to hear his thoughts about applications of these ideas to patient safety. So you can go to leanblog.org/124. And I'm hoping to be able to interview Mr. O'Neill again sometime. So apologize, Vance. I just wanted to kind of insert that.
No, I'm with you. I want to hear it too.
Yeah, I mean, because you got a lot of wisdom and firsthand experiences to share.
And Paul's one of those people that I knew him. I knew his name primarily because when he served in Washington D.C. as Secretary of the Treasury. And so I was familiar with the name, but I didn't realize his background with Alcoa and then his work with Value Capture. And having sit and listen to him talk about safety, it really gave me a very different perspective and really re-energized me. So, I love sitting and listening to him talk about his experiences and how do you say we're going to be the safest company in the world? And it's a very different perspective.
Yeah. Yeah. So I want to ask, because safety as an important priority for any organization, or it should be. I think it's worth articulating and not assuming. But I wanted to ask you, how do you define true north, or how did you help Davis Health System come to agreement or alignment around priorities and the articulation of true north?
Yeah, I had, again, in Iowa, we had used the mother and baby A3, the Hoshin planning for for saying, okay, so where is it you want to be in 12 months, 18 months, whatever your long range planning horizon looks like, where is it you want to be? What is it you want to look like in 2 years, 3 years, 5 years? And what metric will tell you you've accomplished that? Because when I got here, I could see that, yes, that West Virginia had been a little insulated from what was happening with health reform and the changes that were occurring in healthcare, but you could see those clouds on the horizon, and you knew it was coming. And so I said, we really have to put some emphasis on and priority on understanding what's happening, how we're going to prepare for it, and how do we move the organization in that direction. So I brought in and said, okay, guys, how do we focus our planning and say we're going to have some true north metrics? Now, it was interesting. When I was in Iowa, they were really focused on saying that you have, maybe, I don't know if they're still the same, but one true north metric, you've got that one northern star that you're pointing towards, and how do you get there? And my experience with it was leading a hospital there was trying to take all aspects of it. We had the four pillars of quality and safety, patient engagement, employee engagement, and sustainability. But how do you get all four of those to point in one direction? So, working with value capture, I just said, can I just have four true north metrics? And they reinforced, yeah, you can do it, and this is how you can do it. So we set up one true north metric for each of those four pillars and said, that's what we got to get to. If we get to that point, then we should be successful in driving the organization in the direction that it needs to be and accomplishing the things that it needs to be accomplished in order to be successful in taking care of patients, doing it at high quality with importance on safety, and doing it at the lowest possible cost so that we can reduce the price to the customer.
Yeah. So what if you don't mind me asking, what are those four measures?
So we have our patient engagement is, because all hospitals have to participate in the HCAHPS scoring system. Right now we're using would recommend, because to us that's you read about the what's behind the would recommend score. It's a proxy measure for loyalty, patient loyalty. Will they come back to you over and over again? So, we want to, right now our goal is the 85th percentile, so be in the top 15% of hospitals. Where patients say, I would recommend you to my family and friends. And then we have employee engagement, which is we do a survey called the Wong survey. Dr. Wong developed it, so it's named after him. And it's really a survey we do every 6 months, asking employees, do you feel like you do your work with quality and in a safe way? Do your coworkers practice quality and safety? Does the leader of your department, does the senior leadership? So do you believe that this organization is focused on providing a safe environment and quality services? And then we have a sustainability where we talk about we have to have a profitability level in order to sustain and grow the organization and develop the services we need. And then quality is a different one, in that we measure well over 250 metrics between quality and safety, and we need to be transparent with that. So we kind of, from that, we gel it down to about 21 metrics. We call it our executive scorecard, and we give it a grade point average. One of the things I tell people is, everybody understands the difference between a 1.0 student and a 4.0 student. So if you're going to be transparent, give the reader a mark that they understand where you stand when they look at it. So we take every metric and we score it, and we weight it, and we say our GPA is X as an organization, and we even color code those, because every year, it's funny, every year we'll finish a year and we'll say our current goal is 3.4 GPA, so a B student. And we'll get there because we'll focus on the things that are not scoring where they should. And then we'll see we still have areas where we're underperforming. So we'll reweight those categories or those areas and put more emphasis, more weight on those areas. And our score will drop down to 2.5, 2.6. And as we work through the year, we get back to the end of the year, we're back up to 3.4, 3.6 typically. And so it really kind of forces you to reevaluate what are you focused on when it comes to quality and safety, and are you improving? And if you get to your target, go focus on something else. So that has, I think, that's been helpful. I still think the consumer side of this, we show it to them and we try to be transparent about it, but the millennials seem to have a lot more interest in it than the baby boomers.
In that transparency, you mean, as patients?
Yeah,
really.
The patients, the trends, when you kind of display that data, I think that generational effect plays out somewhat in that.
Yeah. Well, and I think there's old societal habits of, and some of it's generational of, doctors are looking out for you. They know best. Don't question them.
Yeah, exactly.
Yeah.
And I've got a good doctor. The patients, one of the things we talk about, patients perceive quality based on availability and affability. And if a doctor gives them those two things, they're a great doctor. They're a high quality doctor. I trust my doctor, which is wonderful. But the younger generations, they're a little, they seem to be a little more data driven, and that loyalty to a specific provider is not what maybe older generations experience.
Well, there's that challenge of, when we talk about the perspective of customers, not every customer is the same in terms of expectations and what that customer values, right? Like, I think about, I look at things differently, I think, because I'm an industrial engineer and a lean person. And, I go to the ophthalmologist a couple times a year, and I'm usually the youngest person in the waiting room by a couple of decades. And I remember once where I could just tell, I knew it was right after lunch, and there were maybe a dozen patients out in the waiting room. And I overheard an older woman say to her daughter, who had probably driven her there, she says, "This doctor must be very good because there's a lot of people waiting." Well, that's completely different than the way I was looking.
Yes, exactly. I appreciate that. Yeah.
Yeah. So yeah, they were stacking us up and forming a queue. And,
when you mentioned 12 people in the waiting room, my mind was already going in multiple different directions.
Yeah. So I'm curious. I want to come back to one thing you said earlier. I think there's always a challenge in leadership, or lean leadership, of finding the balance between setting direction, and you are responsible for the organization. You are the CEO, but also creating an environment where people can speak up, and you play catch ball with ideas, or you get input from others. So how do you balance, earlier you said, and maybe you're saying this a little tongue in cheek, being the final decision maker versus getting input from the leaders who report to you and others in the organization?
Yeah, I think one of the things, a couple of things that we all have, and I do. We all have daily standard work. What is it that I'm going to do every day, and we as leaders we try to be visual with that, and we try to demonstrate that we do it. And then when we're talking, at different levels of discussion with leaders, what I try to do is more talk about what is it that I think we need to accomplish, or what is it that we've established in our strategic plan that we need to accomplish. I really feel like I try to be more of a persuader, because as I'm trying to persuade leaders, this is where we want to go. I'm looking for them to maybe push back on that, and then help me understand why. What are the barriers that you see that I'm talking about? What are the things that I'm saying we ought to be doing? You're having trouble understanding that, or saying we're going to have trouble getting there. And so it's really, I don't, like I say, that the final decider. I think there's very few things where it gets to the point where they come to me and say, okay, you got to decide this, or I see it and I say, okay, I'm just going to have to make a decision about this. I'm really more focused on trying to get everybody's input, and then if I see, there's barriers in what they're presenting, I try to say, okay, here's what I see are the barriers in your discussion or your argument or whatever, and really have that back and forth dialogue. Even before lean, at one time I was really looking into and studying in action learning, which Reg Revens out of England developed that system, which I think is a lot of principles in action learning that are very similar to lean. And but he never really liked to define specific practices. He was always the open discussion, the back and forth, the learning from other people, and the Socratic method of learning. And I think in healthcare, where you have all these specific process activities you're involved in, you have to have tools. You have to have ways for people to learn how to do their work. But yeah, I think as a leader, it's more about that with other leaders, talking about what is it we're trying to accomplish and how do we get there, and let's discuss the best way. And so it's not about being autocratic in what we're doing. It's about it's everybody's learning. Oh, okay. The greatest moments are when leaders are doing observations or doing A3 problem solving, and they're looking upstream and downstream of what they're typically accountable for or responsible for, and they're getting those other perspectives. They're learning what those input activities really look like that they have to deal with, and what the people the people who are experiencing their output, what they have to deal with. And when you're willing to listen to other people, you really get educated. And at those moments when leaders say, wow, I never knew that's what that department went through with the stuff that we were sending them. And so I think it's being willing to have discussions and it's about building relationships with other leaders, so that you're not automatically going, okay, I don't like that person, and I'm just going to tolerate them until we get through this process.
Yeah. Maybe a final question before we wrap up here. What are some of your hopes and goals for 2019? What are some of the challenges that are most important?
Yeah. I think we've been doing this for about 3 years now, and we do what we call our Davis Way training, and we do about 3 or 4 departments at a time, where the leaders of the department, there's usually a department leader, and then there's some there's supervisors within that, and they'll spend 6 months training and the principles of lean, and they'll learn some of the tools. And so as we've introduced that and rolled it out, and we've had, I think, 3 cohorts graduate that process, you're really starting to see some of this cultural activity begin to develop. You hear people who haven't even been through the training, you hear them using the term A3. Oh, we need to do an A3 on that. Or they're starting to use those things, and you hear terms like help chain, and we've got huddle boards up now, and a lot of the departments, and they're doing their daily huddles. And so you're really the vernacular and the methods are really starting to take hold. But one of the things you learn when you're about lean is that continuum of developing more and more tools to do things. So I think in 2019, one of the things is really I think what we're focused on is looking at developing, being more intensive in looking at standard work, and helping people understand the value of standard work. And observations, one of the big observation models we're trying to develop is, and help leaders become comfortable with, is once you develop standard work, observing standard work, not to critique what they're doing when they're doing it, but to understand if they're not following the standard work, what's the barriers and why is that occurring? And maybe the improvement isn't as effective as you thought it was, and you need to improve it again. And so leaders are it's one of the things we try to teach. Your job is to remove the barriers for your people to be able to do the work. Your job is not to fix their problems for them. They fix their problems. You really need to be observing what they do and seeing what the barriers are and helping them improve the work they do. So I think 2019 is going to really be about getting more departments through the training, but also how do we begin to develop a more consistent model of standard work across the organization, and helping people then see opportunities to improve that work.
Yeah. Well, thank you for bringing it back to that theme from earlier about observation. I think that's probably one of the strongest takeaways from all the great thoughts that you shared here today, Vance. So I want to thank you again. I felt maybe we can do another podcast, because I feel like there's a lot that we could delve into. Can I sign you up for that, perhaps? Okay, well, that would be great, because I think it would be there's all kinds of things we could talk about, problem solving, and maybe do a follow up on that. But again, our guest today has been Vance Jackson, the president and CEO of Davis Health System in West Virginia. Vance, thank you so much for taking time to talk with us today. I really appreciate it.
Yeah, thank you. I enjoyed it.
Thanks for listening. This has been the Lean Blog Podcast. For Lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.